is the KUSI News at 6.
The first phase of President Obama's new health care law went into effect today. The goal of the plan is to extend coverage to 30 million Americans.
That's right. Joining us right now to talk about what this means to you is Craig Gussin, the president-elect of the San Diego Association of Health Underwriters. Craig, thanks for taking time out to talk to us. Now, the new law prohibits exclusions for children with pre-existing conditions, yet some insurance companies have already said, no way, we're not gonna insure these kids, child-only policies, right?
Correct. What happened was, and actually it really caught me off guard too, what happened was the government, when they wrote the bill, wrote it in such a way where they assumed that it was going to cover all children's pre-existing conditions up to age 19. But they never wrote in the bill that the insurance companies actually had to accept the application. So when it finally came time to put up, the insurance companies going, wait, we don't have to accept the application. They go, that wasn't the intent. And what insurance companies are going to saying, and I'm assuming the legal department for the insurance companies are saying, well, you know what, we better not write kids because we're going to end up in a major lawsuit. So if I'm the insurance company, I'm going to unfortunately do the same thing. And it really caught me by surprise because I was actually working with some clients to get their kids covered, and I never saw this coming, and most brokers didn't either.
So what happens now? And this is a handful of companies? Is this going to be most insurance companies?
It's probably going to be all of it. Right now, Aetna's done it, Cigna's done it, and Anthem Blue Cross has done it. But if I'm Blue Shield, HealthNet, the other companies, do I want to be sitting out there alone and having to take these people? I probably wouldn't. The way you get around it is, instead of covering just your children, Sandra, we add you to the policy, and now the insurance company will look at you and your child, but not just your child.
Right.
So that's the way to get around it. We're going to have to wait and see what the White House, Congress, and the insurance companies come up with. But the bill was written so poorly, that's why we're in this situation.
Okay, now the law that went into effect today also eliminates annual or lifetime spending limits, right?
Correct.
So what are we talking about there as far as conditions?
Yeah, very simple. Today, yesterday if you bought a policy, your lifetime maximum was $5 to $7 million. It's going to be unlimited for any policy that's bought. In our world, it's going to be October 1st because the insurance companies, everything is dated.
That's for cancer treatments, that's for physicals, that's for...
For everything. And see, there are some policies out there. There's two parts of this. One is that. The other is some companies would say, we'll cover you like for $5 million in your lifetime, but we only cover $100,000 in a calendar year. That's also going away.
I guess I find it disturbing that not only is this thing just so complicated still, but this is just these first provisions are coming in and there are already problems. So what's going to happen with the entire bill?
I'll know more November 3rd.
Yes, I guess
the day after the election. There are some really good parts to the bill. We can't get kids, keep kids on the parents' health insurance until they're 26. We can get kids covered. We all get free preventative. Kids will get medical, dental, and vision. The rest of us get medical. I like that aspect of it. The bad part of it is going to be that because the insurance companies have to pay 100% of the preventative cost, you're going to see rates go up probably more than what the visit would cost.
Craig Gussin with the Health Underwriters locally. Thank you for taking time
My pleasure.
to be with us today.
Thanks, Craig.